Good morning, everyone. I request to please settle down as we'll be starting in a couple of few minutes. Thank you.
All right, good morning, ladies and gentlemen. Thank you so much for joining us this morning. Brilliant Sunday morning, seeing so many of us, 10:15 in the morning. Thank you. Thank you for taking out your time. But those who are sitting at the back, you can actually come to the front. Especially everybody who's sitting at the back, you can actually come to the front, occupy the front seats, and be more a part of this event. At your convenience, though, we're not pressing on to anyone. Ma'am, you're sitting so alone. You can always be a little closer to us. Okay, so thank you very much. My name is Kanishk Parmar, and
My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare.
thank you. And we'll be starting in just about a minute from now. Quick reminder to all of you, of course, goes without saying, our lifelines. In this case, I'm talking about those mobile phones. Okay, let's keep them on the vibration or the silent mode during the course of the event. We will ensure that today's event is really knowledgeable, connecting, and yet we will try to keep this light, but very crisp to the core is the thought behind organizing and planning this entire event for you. The team has worked very hard to ensure that every topic that is being chosen today is industry specific and it is very important and need of the hour. So with that assurity, Simran, I think we're all set to begin without further ado, as we are a little behind schedule. So let us go ahead.
Correct, Kanishk. And we would like to start with now and welcome you all to the occasion of the second edition of IVF Summit and Awards 2025, brought to you by Voice of Healthcare. Can we have a clap, please? Thank you. And this summit is more than an event. It is a collective movement, a coming together of clinicians, embryologists, researchers, industry leaders, policy makers, and most importantly, those who believe that every couple deserves a chance of miracle of parenthood. Because at the heart of it all, IVF is not just a medical journey. It is an emotional one. It is about restoring hope where it was once lost. It is about standing beside someone when the wait feels endless. And it's about turning a quiet dream into a lifelong reality. And today, we honor not just the science, but the stories, the determination of parents, the dedication of doctors, and the quiet strength that ties it all together. Correct, Tanishq?
Correct. You see, today's day will be, of course, emotional.
Yes.
And will be that feeling of joy that parenthood brings, but does not dissect us away from the technology that goes behind IVF. So we will ensure that all the topics, the panels, and a lot of presentations will be about the technology behind, the innovation behind the embryology labs that are working in the country today. And of course, we will also be touching upon surrogacy, donor programs, ethics, and of course the regulations that are involved in IVF by the government of India. So we will be shortly touching upon that as well. But before we touch on all of that, we take this moment to acknowledge our partners who have been instrumental in getting this event together. We'd like to start by thanking our associate partners, Meyer Vita Biotechs, Revity, Gufic Biosciences Limited, Bharat Serum and Vaccine Limited.
Quality and Accreditation Partner, QAI, Quality and Accreditation Institute. Exhibit Partner, Altus Airflow.
Academic Partner, D.Y. Patil University, MGM Institute of Healthcare Sciences, and our contributing partners, Samarth Life Sciences Private Limited, Cooper Surgical, Credent Shine Life. And we would also like to thank all of them for their contribution and getting this second edition on floor once again.
As we believe your commitment to progress and your contribution have made this platform stronger and more impactful. So let's give them a big round of applause for their hard work in making this happen. Kanishk, I think there's one more force behind this. And we should also acknowledge it. And more than acknowledging, we have a complete journey to show, if you can take that.
Definitely. So, Voice of Healthcare has had an incredible journey so far. This is the second edition, but actually, this brings me to the point. Is there anybody here who was also part of the first edition of this summit earlier? Oh, fantastic. And you are the early birds once again here. Thank you so much for being stalwarts and being pillars of support for Voice of Healthcare. We want to take you through this very short film that we have actually prepared to better tell you and give you the storytelling about our journey. Could we have the film, please?
Today's summit, organized by Voice of Health, is a very important event because it brings together various participants who come and they contribute a lot of feedback, a lot of insights.
I think VOH is next in healthcare, and that's leading from the front.
पूरी आपकी टीम को मैं बहुत बधाई भी देता हूं।
I think it's a great platform. It is wonderful to see how these stalwarts in the industry and from various aspects and the oncologists that have come to this session.
I am happy to know that Voice of Healthcare has come up with their 6th edition of their annual healthcare conference with this year's theme as Digital Healthcare 2022.
Thank you, VOH, first of all, arranging this kind of exhibition, this kind of seminar conferences. Trust me, so you have aptly said, Voice of Healthcare.
Yeah, I think this is a very good platform. I can see like so many companies have come here. So which means, it's such a valuable platform. And Voice of Healthcare is really doing a good job in terms of, increasing awareness and getting all these stakeholders together. I really enjoyed the panels which were there today.
First of all, I'm really thankful for Voice of Healthcare. But I am part of Voice of Healthcare from many years. When they started, I think I am from that time, I am always here.
I wish Voice of Healthcare and this event all success in 2022 and in the future.
I think what VOH has done has been fabulous. Just the kind of attendees, the kind of conversations, the people we've met. It's been a wonderful day, very good use of our time, and thank you, VOH. Thank you.
What's been absolutely wonderful about VOH, and I've had the opportunity of participating in previous events, is they take those, it's not just a very, the standardized thing of you come, you present, you go. You look at the key areas which actually you need to shed light on and understand what's the lacunae in that particular area and help find solutions. So you have people from across the board, be it the government, private institutions, researchers, scientists. It's a very inclusive, collaborative approach.
All right, so ladies and gentlemen, as you see that at Voice of Healthcare, we have a single-minded aim of making a healthy healthcare family, not just from the patient's perspective, but from every party, every stakeholder involved. And of course, this is a network building and a conversation starter as well. And you were very visible in the video as the conversation starter. So please, let's start the next conversation going further.
Thank you so much for that. And now to officially begin today's summit, we move to a ritual that is close to every Indian's heart, the lamp lighting ceremony, a symbol of knowledge, of purity, of new beginnings, and of shared light. May I now invite our esteemed dignitaries to kindly come on stage and join me in lighting the lamp lighting ceremony. Dr. Naveen Nishchal. So can we please have you on stage? And let's welcome our dignitaries with a round of applause. Dr. Professor Colonel Pankaj Talwar. So please, may I have you on stage? Dr. Professor Shweta Mittal Gupta. Dr. Amit Patki. Dr. Anushri Patil. Dr. Duru Shah. Dr. Gauri Devi.
Your applaud has to be a little wilder. Come on, everybody. It's right in the morning.
Dr. K.D. Nair.
Thank you. Thank you so much. So, our esteemed guests here, we'd invite you to please light the lamp as we traditionally Thank you very much. Though we will trouble you to shortly join us back, but we wish to introduce you to our guests here and wish to take this opportunity. So thank you. Thank you so much for joining in. So with this, we thank the Almighty and, of course, seek their blessings as we start the event today. You see, ladies and gentlemen, today, the day that we shall be spending together, there are, however, many points, many topics of discussions that we will be pondering upon, but some of them that we want to start with is where we stand in India's fertility and ART landscape. What strides have we made in this context? And what vision we must hold as we move into the future together. So the first session that we'll be getting into these are some of the prime highlights that we will be divulging into. And to start with,
we would like to invite Dr. Naveen Nishchal, founding chairman, Voice of Healthcare, and a serial entrepreneur on stage. Sir, please be on stage. Thank you so much. And let's welcome our speakers with a round of applause, guys. I think it's morning and we all are charged.
And we also want to tell you that there are 6 such sessions. So every time we want that energy and power to keep happening, okay? We will not let you go down, and I promise you this.
Dr. Professor Colonel Pankaj Talwar, VSM, MD, PhD, President, Indian Fertility Society.
Welcome, sir. Thank you so much for being here with us. We are privileged to hear from you. I welcome Dr. Professor Shweta Mittal Gupta, Secretary General, Indian Fertility Society, Co-Director and Unit Head, Center of IVF and Human Reproduction, Sir Gangaram Hospital, New Delhi. Thank you, ma'am, for taking our time and being here with us. Dr. Amit Patki, President, ISAR 2426, Medical Director for Icon Fertility Associates LLP, Country Representative for Aspire 2123, President the Mumbai OBGYN Society 2014-15, Chair West Zone, RCOG 1520, and Governing Council Member for ICOG 12-21.
Dr. Anushri Patil, Scientist F and Deputy Director, Senior Grade, Head of Division of Clinical Research, ICMR, National Institute of Research in Reproductive and Child Health, Mumbai. Dr. Duru Shah, Director and Gynec World, the Center of Women's Health and Fertility, Consultant Obstetrician and Gynecologist at Breach Candy Hospital, Jaslok, Founder President, the PCOS Society of India, Founder Chair, Metropolis Foundation, Vice President, Aspire Asia Pacific Initiative on Reproduction, Member of Women's Health Vertical of C20 India. Welcome, ma'am.
Thank you very much, ma'am, for being here with us. So, in this first session that we wish to start with, we want to address a question primarily to each one of you and get your 2 cents about the topic that we kind of rapid fire to you. But of course, I want to start by inviting Dr. Nishchal to kindly take the podium and set the context and start the event, sir. All yours.
Thank you very much, Kanishk and Simran. Thanks a lot. Let me take out my paper. Respected dignitaries on the stage, Dr. Pankaj Talwar, Dr. Shweta Mittal, Dr. Amit, ma'am, Dr. Duru Shah, Dr. K.D. Nair, Dr. Gauri Devi, and all doctors practicing in IVF industry, embryologists, innovators, policymakers, students, and our audience listening to us online, watching us online through our various social media channels. A very, very warm welcome to second edition of National IVF Summit and Awards 2025. Being an entrepreneur, I have, and as well as a doctor, I view this industry with 2 different lenses. One is very positive side, and that positive side is that our market of IVF is growing day by day. Every year we are growing by 15 to 18% of CAGR. Currently we are at market value of $1 billion. Year on year we are growing. We have more IVF centers. Every year we add more IVF doctors, embryologists. Every year we are adding a lot of technologies, a lot of drugs. So a lot of innovation is happening. That is very positive side of this. And there is another side which is not that positive, which is that burden of infertility is rising day by day. We can attribute it to our lifestyle, sedentary lifestyle, our eating habits, pollution, and so forth. We can attribute to so many different factors. And on top of that, while our burden is increasing, we are also facing the challenge of accessibility, affordability, and quality of fertility care in India. We are a very large country, and I don't think that every city in India has an IVF center. We have around 3,000 towns, 800 districts. I don't think that every district has one IVF center. Being a physician, I'm passionate about prevention. and it is our collective responsibility. And I'm sure, and I see a lot of IVF specialists, those who are friends, I see them, how they are motivating youngsters, couples, that they should not delay their parenthood. So while we are facing a lot of problems, and that is the reason we are here. That is why this summit matters. It brings together all the industry stakeholders, doctors, embryologists, innovators, regulators, clinicians, so that we can shape the future of fertility care, so that we can make it accessible, affordable, and a quality fertility care in India. Without taking much time, I would again welcome you all for this second edition. Today is really very exciting, an exciting day, where you will listen to a lot of thought-provoking sessions, panel discussions, and we have an exciting evening where we'll be honoring all the luminaries of IVF industry. With that note, I once again welcome you for this summit and award. Thank you very much. Thanks a lot. Thank you.
Thank you very much, Dr. Nishchal, for truly setting the tone here for us. So with this, let me start with my questions, and I wish to start my first question to Dr. Shweta here. So ma'am, as being the Secretary General of the Indian Fertility Society, you've often emphasized that awareness is the first step towards timely intervention in fertility care. In that light, how do you see the advancement of diagnostic strategies, particularly in areas like the ovarian reserve assessment and fertility planning? So basically, any other thoughts that you have on this is what we would like you to start and share upon. No, ma'am. Either ways, if you are more comfortable on the podium, or you can just.
So it's a very good question. It's exactly like how you ask in a beauty pageant a question, same way asking a fertility specialist that what is the importance, of an ovarian reserve testing? Have we advanced? Because, if you see the crux of our practice, not a single day, not a single OPD, or not a single moment goes where we have not advised some kind of an ovarian reserve testing. So I remember last year the fireside chat I had with Dr. Durusha, and she started off in the era where it was so difficult even to get the basic hormonal tests, like FSH and LH, which were the markers of ovarian reserve. And then we have moved to 2025, where we still have the same hormones. But what has changed? What has changed is the sensitivity of these hormones. What has changed is the efficacy of the analysis. What has changed is the efficiency of these hormones. Then few years back, about a decade back, came a game changer hormone, which was called anti-Mullerian hormone. Now, again, the platform, I remember we used to have the machine in our own lab, and it was a very exhaustive procedure. It used to take the whole day. But now, in 2025, my husband is a pathologist, and I practically get an AMH report in 1.5 hours. But is that it? No, that's not it, because the efficacy has to be there. The machines are much more validated. So we are improving in technology. Now, after we have standardized our normal hormonal reports, we are now going on to advanced technologies like polymorphisms. We are trying to look at that, are these kind of hormonal tests changing the ovarian reserve? And so many advances have happened, but ultimately, what is the utility? That it is improving the efficiency of a process, it is improving efficacy, and you are giving choices to the patient to take a valid, decision. So I think that is so important. And by bringing in these advancements, we are, I think, trying to make our whole process of fertility care way better. Thank you.
Thank you. Thank you so much, ma'am. So, before I move on to before I move further, I want to come back to Dr. Professor Colonel Pankaj here. So, sir, before we actually dive into from the patient-centric perspective, furthermore, we would like you to get your 2 cents about how do you think of the entire IVF scene at this point of time, and what are your opinions about the same, please?
So thank you so much for this, and I fully concur with what you said, Naveen. I think ours is a huge, the most populous democracy in the world we are living in. I think the most powerful nation we are living in. And as we know that we are the 4th largest economy of the world. But when we look at the whole country, as the president of IFS, look at the whole country, I'm an army man, 30 years in the armed forces I've spent. We barely have 8 Class A cities. We call them Tier 1 cities. So look at Mumbai, Delhi, maybe Mumbai, then we have Gurugram, we have Pune. We barely have 8 cities in the country which probably can beat or which can come near Singapore or Hong Kong, and we are very much far away from them. We have got around 32 cities in the country which are Tier 2. Rest all are Tier 3 and Tier 4. Tier 3, Tier 4 are not very well defined. So we have got 28 states and around 8 UTs. Look at the whole country's population, the whole country. We feel that we have got majority of the health services coming up in few big cities. It's a big divide in terms of layout of the fertility services. Though we can open buildings, we can have good clinics. Look at the guidelines, look at the website of ART surrogacy portal. We've got around 6,500 units which have been registered for doing some sort of ART practice. How many are level 1, how many are level 2, we still don't know. But with my estimate, I think, say around, out of them, around 3,000 will be ART 1 and rest may be ART 2. So I think there's a big divide in our country, and this is a very good initiative on behalf of VOH to get everyone together. Thank you, Naveen, and the whole VOH team. We are having the 2nd edition with them this year, and next year I think we'll be having it at Bangalore too. So from IFS side is a little message that IFS is we've got our basic DNA, our basic theme of our working is to collaborate, to do networking, to educate, get the science together, to empower the women in the country. So how IFS works is to get the women empowered, educate them, train them, so they can look after not only 8 Tier 1 and say few dozens of tier 2 cities. We are focusing on Tier 3 and Tier 4 cities. And not only the gynecologists, we are focusing on the patients. Actually, no one talks about patients. No one talks about our consumers. What I have strongly felt is that we come for conferences, have a nice day out, and then we go back to our own work. No one, we have got, we never ask a patient that, how do you feel about our treatment? Probably either they are ignorant or we are equally ignorant. So we want to bring patients into the mainstream, and we've got 2 major programs which we have done in the country, and one we are launching again. That's about the patient empowerment program, where our clients, our consumers can talk to us and ask what have you done for them. That's called our patient empowerment program. The second major thing which we want to have is that we want to have very symbolic green babies. We are breathing in very bad air. We are breathing a very polluted air. As a result, we talk about multiple EDCs, multiple pollutants, and we talk about epigenetics. So IFS is focused on creating a green wave in the country. We are bringing out a paper on green clinics, green ART clinics. We have enrolled multiple centers, and we got a team of around 100 doctors working around the clock to make our country having green sustainability. We want to reduce carbon footprint of our ART clinics, ART labs. As a result, when the carbon footprint goes down, as per the Paris Treaty, I think we can really do a good job and bring probably green babies in the womb, and they take birth as very healthy babies. We also focus quite a lot on making guidelines and white papers. We have made very nice guidelines on PCOS. We have made guidelines on poor ovarian responders, and many of them are in the pipeline. This year we want to bring out 11 GCPR papers, which will be launched in our national conference in Delhi in December. Then we very firmly believe that we have to empower the woman. And I feel to empower the woman, the most important thing is that give her technology. As I said, that our country is not about few gynecologists who are sitting in Mumbai, Pune, and Delhi. They are the ones who are in tier 3, tier 4 cities, which are not, actually we don't even talk to them. And to make their life comfortable, we are fully envisioned. We are fully charged up, and that's what we are doing, that we are running programs on AI, where we give a tool in the hand of every gynecologist so that she can make her life more comfortable. So I think the theme of IFS for this year has been to create green babies or green clinics. And also our slogan is that every gynec should know about ChatGPT, maybe any search engine, so that she's able to do good in her life and she can focus more on her work. Training is very much in our mind. And we have got fellowships running. We got fellowships running where we train people in embryology, we train people in IVF, and we have got ASHRAE preparatory courses. Dr. Kuldeep is here, and we are running it for more than now nearly 12 years, where we train embryologists to apply for ASHRAE certifications. So a lot of good work has been done, and with me, I have Amit. We have been working very, very closely. So ISAR and IFS is working very closely to bring some semblance, which he'll be also talking about in some time, where we all work together and reach more people. So I actually wanted to just, at the time of inauguration, we were waiting for Shrimati Aditi ji. She'll be joining us in the afternoon today. She got some other engagement, and Daksha Shah, she had to join, but she's also delayed. Probably we'll be meeting her in the afternoon. Today's the whole program is focused on some basic themes, like we have done every time. It's not only about science, it's about the holistic growth. And today we're going to talk to you about, the first topic will be transition of a woman. How a woman is transiting, what Shweta just spoke, PCOS and drugs. We're going to talk about laws and ART, surrogacy. We're going to have some panels about that. We'll talk about male infertility. We're going to talk about how the industry is growing. We've been talking about CAGR and 18% CAGR from past 7 to 8 years. But I think we are still stuck at around 13, 14 CAGR. Why is it not happening? We're going to talk about that. And we'll going to talk to pioneering people. We'll be talking to Dr. Indra Hinduja and Dr. Kamini Rao. And that's the way we're going to take it further in the day. So I think that's all from my side, and thank you so much for inviting me here.
Thank you, sir. Thank you so much. We would get you back to as we continue our conversations during the day. But with this, I want to hand over the baton to Dr. Amit Patki here. So, as you're leading ISR, what role does clinical leadership play in shaping an ethical and innovative IVF ecosystem in India? And how does ISARs guide the practitioners through the next phase of growth and quality improvement? So if you can give in your opinion on this.
Good morning, and thank you, Naveen, and thank you, VOH, for having ISAR here. I bring you greetings from over 6,000 clinicians, embryologists, and counselors who constitute ISAR. Every organization works for its members, and our main aim is to empower our members to do good practice, to know what is happening in the world as far as latest technology is there. But at the same time, we know we are all inundated with so much of knowledge that we do not know. It's very difficult to see and find out what is actually the truth and what is actually sometimes maybe just a myth or a distraction in our practice. So ISAR does master classes where we come up with GCPRs, which are good clinical practice recommendations. We come up with consensus statements, and we are happy to say that we had a joint consensus with IFS on various topics. So we work together, and I think empowering your members is the most important thing. We look after them, and if there are any issues as ISAR, we try to follow up and make sure that they can practice in a very stress-free environment. The other responsibility of an organization is advocacy, and we have been in touch with various organizations. Very few of you would know that the fertility rate is declining in India, barring 5 states. So we are all at 1.9, where the replacement rate is 2. So it's very important that we bring this to the government. The government talks about family planning. Government very rarely talks about infertility, and we have approached the government of India at various levels, and even WHO, where we have requested them to make small changes. So instead of calling it Family Planning Department or Ministry, they should be calling it as the Family Welfare Ministry, and have all these family planning contraceptives, but also infertility under one arm, one umbrella, so that I think we can help our patients who are so looking forward to have children. At the same time, ensure that those who do not want to have children are using the right methods of contraception. We have also approached WHO, and we'll soon start working in the 5 states where the replacement levels are very high, because we should understand that there has to be awareness amongst patients. So once you empower your doctor, you indirectly empower your patients, because they will be offered the best help. I'm very happy that organizations like VOH bring a lot of stakeholders under one umbrella like this meeting, and we can have a fair exchange, and I think it's only synergy that will help us to bring what we all strive for, to help our patients to have a healthy baby. ISAR is also working on moving the benchmark. I think a benchmark in all IVF centers is live birth rate. I think it's time now, after 35 years, to talk about maternal and neonatal health. It is extremely important that we just don't look at how many live babies are born. We look at their health. There are various technologies that we are using indiscriminately in the hope of giving babies to couples, but we do not know the long-term effects, maybe 10, 15, 20 years later, whether they would come out as healthy adults. So I think the benchmark has to move. We moved it from clinical pregnancy, where we saw it on sonography, to live birth. I think it's now time to move it to a healthy adult and a healthy mother. We are also working with government on the Ayushman digital mission. I think the government has approached us, and we are fascinated. We are trying to get our members to register, because it is important that all the records are under one roof. The patients should know what is happening to them, and if the patients want to register themselves as a fertility patient, as a fertility clinic, first we have to register. As fertility doctors, we have to register. Only then there is data sharing after the patient's consent. It is important that if the patient moves from A city to B city, the doctor there should have an access to know what all has happened to that patient. Unfortunately, fertility is the only branch where the patients are completely unaware sometimes of what treatment has happened. Most of them do not have any records with them, and then the doctor in the B city will start with step 1. So it's a waste of a lot of resources, waste of the doctor's time. So we are joining hands with the government and trying to register and put all the data, which is actually there with the government, on the digital mission. So I invite even IFS to join hands with us, and IFS based in Delhi, I'm sure will be able to push this more, because I think it is time that as other European and American IVF centers, we have some data to show. Unfortunately, we talk of 3,000 units. We do not know how many IVF centers are there in India. That basic knowledge is not there. I think we are the second largest IVF cycles in the world. But who knows? We do not know, because we don't have the data to share. And when we go to any international conferences, we feel ashamed to say that such a big country has no data to share be it on what is the percentage, what is the IUI, what is the IVF ratios. Everybody is doing excellent work, but very few documentation. So I think it's time that VOH and various other organizations come and get this data, because I think we'll proudly say that we are the largest IVF in the world, and we get recognized for that. Presently, I don't think we get that recognition which we deserve. Thank you.
So Amit, we're working very closely with Ayushman Bharat. For all of you, just wanted to apprise you that we are supporting them to make a software. We are going through various companies, where softwares we are analyzing our team.
They already have 5 people with their software. We just have to choose which one, and then you just register.
Correct. So what I have told them is that they should get Foxy, ISAR and IFS together, and ACE. They're big bodies, and so all can come together. And then I think we can all have joint discussions. But it's a very good thing the government is doing, and they have employed a company called Deloitte, which is working for them. I think within 3-4 months we should be seeing some light on the day, and it's a very good initiative by Government of India. So thank you so much.
Thank you. I think the very first session is already getting exciting and interesting. I see that discussion very productive there. So with this, I will quickly hand over the baton to Dr. Anushri now. Ma'am, based on the ICMR's work and national research, what trends are you seeing when it comes to fertility, age-related reproductive changes, and the PCOS prevalence? What does the data tell us primarily about it, and how can practitioners align with it even more closely? So if you can share your opinion on that.
A very good morning to everyone, and I bring greetings from the ICMR family, and thank you VOH for having ICMR NIRRCH on this knowledge sharing platform. Since I come from ICMR, I would be talking more about the data. So there is one thing which we clearly need to understand is the difference between low total fertility rate and the biological infertility. So the low total fertility rate is the number of children a woman has during her lifetime, and the biological infertility is the inability to conceive. And that also, when it is looked into the data, we don't have a national level ICMR data on infertility as such, but we do have estimates from the NFHS. And when they do the estimates from the National Family Health Survey, what they look into is the 5-year inability to conceive. So that is what is we need to understand first. And why it is important to understand this is because the causes of low TFR are different from the causes of biological infertility. Low TFR can be because of a lot of socio-cultural reasons. I'll just give example. Now we were invited by the Sikkim state government because Sikkim, the total fertility rate is reducing and it has almost gone to 1. And now we would be doing a research proposal, research project in Sikkim where we are trying to look into the causes of low TFR. But their infertility is not as big as a problem as the socio-cultural reasons, because women are not willing to get married, they are not wanting to have children early, so the reasons are different. So we need to understand this difference, and that is what is more important. Now, there's a recent paper which is published in JRI, and that shows it's an analysis of the NFHS data, and that shows about the biological causes of infertility and which are the states which are highest in this. And there's a lot of variation in different states with respect to the biological causes of infertility when they look into the 5-year time span. And in this, the topmost are the union territories, which includes Goa, Lakshadweep, and also Chhattisgarh. Now coming to our institute's work in this area, we had, since we are from the government background, what we try to work more is the government health system and trying to improve services so that, the common man gets more services for these particular areas. So our institute is a WHO collaborating center in reproductive health. and the 4 WHO collaborating centers in India, that is our institute, AIMS Delhi, PGI Chandigarh, and Sevagram Varda, we had developed recommendations for the management of infertility in the public healthcare system at the grassroots level, because we have a lot of it happening at the tertiary healthcare level. But even the simple guidelines for managing nothing exists below the district hospital level. So for the primary healthcare level, we had developed these recommendations which were submitted to ICMR. And another study which we had done was with UNFPA. And this study was done in 12 states across India in 6 zones of the country. And there we had looked into the service readiness of the health system to manage infertility. And as it is, most of us know, the services were really very poor. The facilities were not there. But however, it involved healthcare provider surveys, facility survey, lot of things. But the willingness to provide the services was there. And from there is somewhere we can take it forward. One very important study coming to PCOS, the 2 important things which we also see in the clinics these days are PCOS and also premature ovarian insufficiency. So there was a big nationwide study which was conducted by ICMR, and Dr. Ashraf Ghani from SKIMS had led this study, and our institute was also a part of this study. And this study was conducted in 9 states across India, and it had a sample size of around 1,000 women. And we looked into the prevalence of PCOS among the urban women as well as the rural women. And the prevalence of PCOS, and this study is published in JAMA Network. And this study showed that the prevalence of PCOS by Rotterdam criteria was 19.6%. And what I would like to highlight as per the data is that among these women with PCOS, it was a very systematically conducted study. Among these women with PCOS, 43.2% were obese, 91% of these women had dyslipidemia, 32% of these women already had NAFL, and all these were women of reproductive age group, means they were not very old, but of reproductive age group, and 24% had metabolic syndrome. So it is very important to focus on all these aspects and not just the prevalence data. And coming to the actions, the last point, what have we done for this? So ICMR NIRRCH has initiated a multidisciplinary clinic for PCOS. And we have this model running for quite some time, and we are very proud to say that our model was in a global systematic review. It was one of the 4 models globally which adheres to the international guidelines for management of PCOS. And we have now also initiated the multidisciplinary clinic for premature ovarian insufficiency as well. And what ICMR would henceforth like to take forward is bridging the gap between the urban and the rural health system in these areas of infertility, PCOS, and POI. Thank you.
Thank you. Thank you so much. Dr. Shah, I would now hand it over to you. Now, as you are leading the PCOS Society of India, and you've led multiple awareness programs in this field and also for hormonal health, from your experience, what are the biggest public misconceptions still out there? And what role can national platforms play in strengthening awareness and early diagnosis of the same? So if you can please share some light on that.
Thank you very much for inviting me. And again, I bring greetings to you from the PCOS Society of India, which was created about 10 years ago. It's a multidisciplinary organization, consists of gynecologists, dermatologists, endocrinologists, and all the other faculties which treat PCOS. So when we have so much of PCOS being talked about, which we never spoke about 10 years ago, that is when I took up the challenge. I said we need to do it because women were not getting the diagnosis they needed. They went to the dermatologist with hair on the face, they did laser, laser, laser. They came back with more hair. They went to an endocrinologist for their obesity, and the obesity somehow wouldn't really go back. So there were, with gynecologists, it was irregular periods, infertility, heavy bleeding, etc. So there was no proper consensus or diagnosis being given to them. As a matter of fact, when we were medical students, there was hardly even a chapter on PCOS in our syllabus. And even today, there's not much in the medical curriculum which is present. So in short, it was important for us to bring forth or bring it to the center, talk about PCOS, because that is something which was not being discussed. And hence, bringing this team together, in the last 10 years, I think we have made a great impact that many people, even today on the stage, are talking about PCOS, which was really being discussed before. So when we talk about PCOS, there's a lot of myths surrounding PCOS, especially with people who suffer from it, and even from the physician point of view. Many of the myths which exist with PCOS are that, oh, it's only irregular periods, or it's only heavy bleeding. The daughter is told by the mother, this is normal, it happens as you get older, it'll get better. Even their family physicians tell them the same thing. Don't worry, once you get married, you'll be fine, which is not right. So in short, getting facial hair, getting all the obesity, it's a lot of mental health issues also. Many of them are pretty depressed and do not want to go out in society and face people, because the young people today want to be seen with their partners, want to be seen dating. They don't get any invitations for dating. So it's a difficult situation for these girls, and there's nobody looking after them. So in short, we need to definitely get rid of these myths, because one of the biggest myths is that, oh yes, I'm 40 now, all my periods are regular, I have no problem, I've had my children, I'm done. But it's not done, because after 40 start the chronic illnesses. Comes the metabolic syndrome, comes the obesity, comes insulin resistance, there's cancer of the uterus, there's hypertension, there's diabetes, and it's one of the biggest risk factors for diabetes. So in short, we need to be focusing on these young girls and starting from there, not from the time they have actually suffered. But beyond that, I think it has to start before conception. Because today I find there are so many clinics, IVF clinics, even I run an IVF clinic. But the question is, how many of these women really need IVF? Just because they have irregular periods, it doesn't mean they need IVF. What we need to do is correct their hormones, because there is enough evidence to show that if the mother who conceives is hyperandrogenic, she's obese, she's got metabolic syndrome, there's a high risk of that fetus, which is in the womb of the mother for 9 months. That fetus is being sort of facing all the hormonal changes within the womb, and this is where epigenetics comes in. PCOS is not transmitted really genetically. Hardly 5 to 10% is genetic. Most of it is epigenetic. So the word I want to get out there is, first treat the hormonal imbalance. It will take just 2 to 3 months. And if you're going to do an IVF, go ahead, do the IVF. Waiting 2 to 3 months is not going to matter. Just correct everything before letting that woman get pregnant. And it's seen that when you do IVF, obesity to some extent doesn't really matter. For spontaneous pregnancies, yes, you need to lose about 5 to 10% of your weight, your periods get regular, and then you can get pregnant very soon. So this I have seen in my own practice, that every woman whom I correct, a percentage, at least 20-25% get pregnant on their own after their hormones are corrected. Maximum, they may be requiring a little bit of ovulation induction and timely either artificial insemination or spontaneous, timely self-insemination with husband. So in short, I'm talking about PCOS, which has myths, which has got a large amount of prevalence. We have been educating doctors through various courses, certificate programs, educational sessions, webinars, E3, day-long seminars, conferences. We have done a lot. We have created guidelines along with the international group. We have been part of the guidelines both in 2018 and 2023. PCOS Society was invited to participate in that, and we have done our bit by bringing in the Indian ethnicity guidelines into it. And therefore, with all this and circulated guidelines, we've done enough education for doctors. At the same time, we started two years ago a program for patients called Vijayata, where we have covered more than 3 million people all over the country, both through physical sessions and through virtual sessions. And what we have gathered from all those sessions is that we have been able to assess that almost 20% of women who have attended our program are probably having PCOS. We have created a tool which we send out to everyone, or we collect online when we are with them or physically. And we are also aware that the awareness which was there before the lecture we gave was 60%, and after the lecture went up to 90%. So all that impact assessment has been done, and we have been able to assess that, and now we wish to go further into the field, and we've got plans for this financial year where we will take this awareness to patients in the form of a service. That is the idea, that once we have suspected someone, through a very basic tool we have created, use that and then invite those patients to get their tests done at either discounted prices or totally free. We are working on that. Once we have confirmed the diagnosis, then put them onto the necessary treatment. It's expensive because young people do not have money to go for cosmetic issues, for going for all kinds of therapies, for IVF. And that brings me to the point that in 2018, when I was the president of ISAR, I met the person in charge of Ayushman Bharat, Dr. Indu Bhushan. Went and met him with all the paperwork, all the evidence that why the poor or the economically deprived people need to be addressed for their infertility. He sat with me for a good 45 minutes and he said, "Don't worry, doctor, I'll do something about it." In 2 months, I saw in the newspapers, it's brought under the insurance program. I don't think many IVF people know that IVF can be now brought under insurance. And he also told me I'll introduce it in the Ayushman Bharat scheme, after which 40 IVF centers have been established in medical institutions, and it's going further. And I think it's important for any leader of any organization who's there for some time in that organization to take all these leads, take it into public policy. And we have done quite a few of such policies. With Foxy, I managed to get adolescent reproductive sexual health in the National Health Policy. With IVF, this is what I did. This is as chair of the ICOG, I brought in intravenous iron therapy in the primary health centers as a treatment for anemia, because we had realized that women are not taking oral iron. So there have been various such things we have done which has helped to improve the health of women in the country. And I think this is what my thing about PCOS is, that we have focused on those women, and we have focused and tried through multidisciplinary ways in bringing them a lot of relief and taken away a lot of their grief. Thank you very much.
Thank you so much. So before I close this session, any one of you would like to say any closing remarks? You've got 2 minutes. If anyone wants to contribute and say something before we shut this session.
I think it's very important that organizations like ISAR, IFS, PCO, ACE get together and have a 3-year plan where we have advocacy programs, because I think it's very important now that infertility comes up on the insurance in a big way, that infertility is offered as a private-public initiative. And I think the government has to look at it. And as I said, a small change from family planning to family welfare will go a long way in people understanding and the awareness going down. So I think it's up to organizations and people like you who will bring these organizations together and maybe have a 3-year mission plans.
Very powerful thought, I think. Yes, you want to say something, Laksha?
Yeah, I want to say that today, as physicians, we are in the time zone where if we all collect together, all organizations, where we all collectively get together and educate the woman, in all the different fields. Like it's very well said that you educate a woman, you've educated the family, you've educated the village, the town, the nation, and that's how we can improve the healthcare of women. When the demand comes from them, we'll have to give it to them. And we are lucky that we are in that space today where we can all collectively work together towards women's health. Everyone in this audience can work together and we can help women in this country. Thank you.
Thank you. Thank you so much. I think this is powerful, ladies and gentlemen. Let's have a round of applause. You're already in not just for a summit, but a future of the reproductive health that is about to be set today as a tone today. So,
Very rightly said, Kanishk. And with that, we have come to a point where we would like to thank and express gratitude to our speakers here. So I would like to invite Dr. Naveen Nishal to please come on central stage and to felicitate our speakers. Dr. Professor Colonel Pankaj Talwar. Let's have a round of applause for our speakers and for the insights they have shared with us today. Thank you, sir. Dr. Professor Shweta Mittal Gupta. Thank you so much, ma'am. Dr. Amit Patki. Thank you, sir. Dr. Anushri Patil. Thank you so much, ma'am. Dr. Duru Shah.
thank you so much. And if I could interest all of us to come together for a group picture as well, as we would definitely like to take this as a memory for this event. Please, if we can all be together.
And let's have a round of applause for this amazing panel.
Just one word I want to say. While one of the objectives of UH is forging collaboration, and I'm happy that we have all four organizations on this stage, IFS, ISA, PCO Society, ICMR, and everybody is talking about collaboration. I think this is what excites me, and that is why we, do such kind of summits. So I would urge all of you to speak offline, and what you are thinking to do something together, let's start it today. Thank you very much. Thank you.